Good afternoon, all. And today is the new topic you will be looking that the class is on the general anatomy of blood vessels. So, if you look in your body, there are three types of blood vessels are present in the body. The three types of blood vessels are arteries, veins, and the capillary. So, if you look in the body, there are three main types of blood vessel. These three main type of blood vessel are called as arteries, veins, and the capillaries. They are arteries, veins, and the capillaries. Okay. Now, what do you mean by a system called as a cardiovascular system? What do you see? What are the component you look in the cardiovascular system? The component you look in the cardiovascular system is the heart. You can see here that is the heart. This is the heart. From the heart, the blood is carried through the arteries, then through the vein, capillaries, sinusoids, and the cavernous tissue. These are all the component of the cardiovascular system. You see heart, arteries, veins, capillaries, sinusoid, and cavernous tissue. Okay. Now we look into blood vessel. Okay. The integrate network of hollow tubes that transport blood throughout the entire body. There are two systems you look. There one is called as the arterial system and one more is called as the venous system. Arterial system. What does the arterial system do? Transport blood away from the heart. The blood from the heart is transported from there to the other organ or tissue of the body. That is done by the arterial system. So, arterial system consists of arteries, arterioles, and capillary. So, the arterial system consists of arteries, arterioles, and capillaries. Next, you look into the next system that is called as the venous system. Transport blood towards the heart. So it consists of venues and veins. So just know what you mean by arterial system and what do you mean by venous system. So look here. Arterial system, you look arteries, arterioles and capillaries, and venous system you look venues and veins. Okay, now histologically we look into this system. Okay, what you look when you look into the histology of this system? What all you look into it? So, basic structure of the blood vessel. What you see in the basic structure of the blood vessel? Any blood vessel you look, there are some three layers present in it. See, all the blood vessel except capillary have three concentric arranged basic coat. Okay, we call it as coats. Coat is a anatomical, we call it a tunics. So you can see there are three concentric rings, 1, 2 and the 3. There are three concentric rings. So these rings are named from inside out. You can name it as, you can see here, this inner one is called as tunica intima. Inner, so it is called as tunica intima. The next layer you're looking here, this layer, that layer is a middle layer. We call it as, you can see the arrow put up, this one is called as tunica media. The outermost layer, it is called as tunica adventitia. So, the blood vessel consists of three concentrically arranged basic tissue. The basic coverings, they are called as tunica intima, tunica media and tunica adventitia. Tunica means coat. They are the coat of the blood vessel. Okay, this is what you're seeing the longitudinal. If you look into it from inside out, whatever I've told you that, see here the inner one we call it as tunica intima. The middle one is called as tunica media. The outside one is called as the tunica adventitia. So these are the three coats of the blood vessel. You can see the one in this side and this side. So tunica intima, innermost, media, the middle one, the outermost is called as a tunica adventitia. Okay, this you are looking the slide. Okay, this is the histological slide you are looking. From inside out you can make out, see the layer. Okay, the inner one, the layer you are looking, that is called a tunica intima. The middle, the thick layer you are looking here, that is called a tunica media. The outermost layer, this layer you are looking, that is called as a tunica adventitia. So this is the histological slide. You can see the staining there. So this is the histology slide of the blood vessel, what you're looking at. Now, we'll go into detail of all this layer, what all you can see in the all these layers, okay. The first layer, if you look, what we have spoke, that is called a tunica intima. So you can see this layer, okay, this is the layer you're looking, that is called as a tunica intima. What do you see in the tunica intima? The first you see the endothelium, this is the endothelium you're looking, okay. This is the this is the endothelium you're looking. So the endothelium is made up of the epithelium lining. The epithelium lining of endothelium is simple squamous epithelium. You know what do you mean by simple squamous epithelium? We have dealt in the epithelium class. So learn what do you mean by simple squamous epithelium. Next comes the basal lamina. Next, the subendothelial connective tissue. So these are the things you see in the tunica intima. So tunica intima consists of simple squamous epithelium, basal lamina, subendothelial connective tissue. So these are the features you see in the tunica intima. Okay, the tunica intima, you can see this is the tunica intima. The tunica intima is separated from the tunica media by a layer. That layer is called here, this is called as the internal elastic. You can see the wavy running like this. That is called as the internal elastic lamina. It is called as the internal elastic lamina. Okay, next layer you will be looking the thick layer. You can see here this layer is called as the middle layer. We call it as tunica media. Okay, what does tunica media layer consist of? If you look the tunica media layer, it consists of concentrated layer of smooth muscle and elastic fiber. You know how to draw the smooth muscle. You can see here these are the smooth muscle, okay. You can see these are the smooth muscle. The smooth muscle, and in between you can see the fiber running like this. These are the fibers you're looking. They are called as a elastic fibers, wavy like running fiber. They are called elastic fiber. Few collagen and reticular fibers and proteoglycans. And outside you can see the tunica media is separated from the tunica adventitia by a lamina. That is called as this layer, that is called external elastic lamina. You see the external elastic lamina. So remember, what do you see in the tunica media? The tunica media consists of smooth muscle fiber and elastic fiber. Smooth muscle and the elastic fibers are present in tunica media. Okay, see the layer, if you look, thicker in arteries than in veins of similar size, has relatively more smooth muscle and elastic fiber in arteries than in vein of same size. I'll tell you what is this when I go to the elastic arteries and the large size vein. Just now know what tunica media layer consists of. Just know what it has in the layer of tunica media. Okay. Next, the outermost layer you are looking, this layer, it is called as the tunica adventitia. So the tunica adventitia consists of numerous collagen fiber and few elastic fiber. And you can see this part. Okay, here so you can see they are called as vasa vasorum. These are called as vasa vasorum. What do you mean by vasa vasorum? I will tell you later. Just now know there are presence of vasa vasorum. Okay. We have dealt with the three layers, the coating there. They call as tunica intima, tunica media and the tunica adventitia. Now next we look, what do you mean by arteries? Thick walled blood vessel that carry blood away from the heart. You can see this is a heart, okay. It carries the blood away from the heart. You can see it carry the blood away from the heart. Divide repeatedly branch of a tree. You have seen a tree, you know the trunk, okay, then it divides into many branches. Same way you see the artery, you see the main vessel which is dividing further into many branches. The many branches are called, you remember like that, they are all called as arteries. Arteries will further divide into arterial. So you can see here the arteries in the figure here. This is a larger, this region it comes a larger artery. You can see the arrows they are showing you. This is a large artery. Then going into the muscle and all, it is called a muscular artery. Then the smaller one is called as arterial. Arterial further will form the capillaries. So same way, arteries are thick walled blood vessels that carry blood away from the heart, divide repeatedly like branch of a tree, gradually become smaller in size, decrease in the rate of blood flow, facilitate exchange through the capillaries. Okay, this is what about the artery. Okay, large size artery, other name for the large size artery, we call it as elastic artery. Medium size artery, we call it as muscular artery. So know the other name also. Large size artery is called elastic artery. Medium size artery, we call it as muscular artery. Okay. See here, the arterial system consists of elastic arteries. I told already, elastic artery called as large artery. See, what features you see in that is more elastic fiber and less smooth muscle in tunica media. Remember, in large size artery, which layer is thick? Tunica media layer is thick. Okay, muscular artery, otherwise called as a medium size artery, more smooth muscle fiber and less elastic fibers in tunica media. Okay, this is the histologically how to differentiate between the large size artery from medium size artery. Okay, arterioles. One or two layer of smooth muscle cell in tunica media, capillary, only tunica intima and underlying basal lamina. Okay, now we look into the histology. Okay, arteries. They carry blood away from the heart. The tiny branches of arteries are called arterioles. Arteries are thick walled, lumen is smaller. Arteries do not have any, this is valve, okay, valve. VALVE, valve. They do not have valve. This is about what do you mean by arteries? They carry blood away from the heart. Tiny branches of arteries are called arterioles. Arteries are thick valve and they do not have valve. VALVED, that is valve. Okay, now the structure of an artery, if you look, there are three layers: tunica intima, tunica media and tunica adventitia. You can look into the figure here, tunica intima, next the tunica media, and the outermost is called as tunica externa. This is the same that showing you what are the three layers you are looking here, are the three layers of the blood vessel. Okay, now you can see in this slide about the histology of large size artery. See, this is of the histology slide. So the other name for the large size artery, it is the elastic artery. The other name for it is called as the elastic artery. The elastic artery is the other name for the large size artery is elastic artery. So see in the slide here, in the diagram, see the layer. The innermost layer is called tunica intima. The middle layer, the thick layer you are looking here, almost this one, the thickest layer, tunica media. The outermost layer is called tunica adventitia. So in the histology only you can make out which layer is thick. In this figure only you can make out which the tunica media is the thickest layer. The tunica media layer is very thick. Then what are the other features you can see? Okay, tunica intima consists of endothelium, subendothelial connective tissue. Okay, endothelium, subendothelial. Then the main features you see in tunica media here. The tunica media consists of more number of elastic fibers. You can see the elastic fibers running here and there. The elastic fibers you can see more number of elastic fiber and less number of smooth muscle. So see that more number of elastic fiber and less number of smooth muscle are seen in tunica media. So if you get to see the large size artery, so remember the layer, okay, the tunica media layer is very thick. It consists of more number of elastic fibers and less number of smooth muscle. Last, the outermost layer you are looking here, that is called a tunica adventitia. The tunica adventitia consists of collagen fiber and some, you can see this one. These are all called a vasa vasorum. What do you mean by vasa vasorum? They are artery supplying the artery itself, means this is a lumen. Okay, so this up till 2/3 of it is supplied by the blood. This region, the artery blood supplies from the vasa vasorum. So these are the features to be remembered in large size artery. Okay, see here, point to be remember, three layers from inside out, tunica intima, tunica media and tunica adventitia. Tunica intima lined by squamous cell, endothelium surrounded by subendothelial connective tissue. Tunica media is very thick with more number of elastic fiber, few smooth muscle fiber. This point you have to remember about the last slide. More number of elastic fibers and the few smooth muscle. Okay. So remember this point. Okay. This example for the last size artery, aorta, brachiocephalic trunk, common carotid artery and subclavian artery. These are all examples. So you have to know the example for each any slide also. Okay. Aorta, arch of aorta or aorta. Have you heard? It is an example for large size artery. See, you know the rubber band, how it stretches and relax. Okay, the same way large size artery. Okay. So other name for large size artery is elastic artery. Next slide you are looking, that is of the medium size artery. The medium size artery is also called as a muscular artery. So the muscular artery, if you look, same, the point are same. There are three codes. What are the three codes? Same. From inside out if I go, they are called a tunica intima, tunica media and tunica adventitia. So which layer is thick in the artery? The layer which is thick in the artery is the tunica media layer. The tunica media layer is very thick in the artery. Okay. How do you differentiate the medium size artery from large size artery is, you see in the medium size artery, what you can make very prominent, you can see they are smooth muscle. You can see very prominent smooth muscle fiber. Okay. So write more number of smooth muscle fiber and less number of elastic fibers. Next point, you can see very prominent one more here, that is the internal wavy like running like this, internal elastic lamina. You can see very prominent internal elastic lamina. So these are the identification point for medium size artery. Okay, look here, three layers from inside out, tunica intima, tunica media and tunica adventitia. Tunica intima lined by squamous cell endothelium surrounded by subendothelial connective tissue. Next, this point is very important. Internal elastic lamina is more prominent. Next, this one. Tunica media is as thick, has more number of smooth muscle fibers. So remember this point. It has got more number of smooth muscle fiber and less elastic fiber. Okay. These are the points of the to be remembered for the medium size artery. Okay, what are the examples for medium size artery? Any artery supplying the muscle. If I tell you of upper limb one artery, if I name them, one artery it is called as a brachial artery. You can write that. Okay, they are the example for medium sized artery. Okay. Now next, what do you mean by veins? Veins, they carry blood away from various tissue of body back to the heart. Veins are formed by union of many tributaries. Okay, so when you name it, just see, okay, arteries, we call it as arteries, they are branches. When you name a vein, we call it as many tributaries. You can see many tributaries. You know, river. Okay, you have seen many tributaries will join and form the main. Like if you see a Ganga or any, so you can see that many tributaries will join and make a main stream. The same way we tell tributaries no for the river. The same way here also, veins are formed by union of many tributaries. Arteries, they branch, vein formed by union of many tributaries. Small veins are called as venules. They join to form veins. Veins are thick, thin walled, and veins have got valves. Okay, what do you mean by valve? Okay, you know the blood veins, they carry blood towards the heart. They have to go against the gravity. Like this, no, the blood has to move. So against the gravity when they move, there are presence of valve. So it allows the blood to flow only in one direction. It can't go in the opposite way. Like this, it can't go. Okay, opposite way. No, it can't. Because of the presence of the valve. So remember, veins are thin-walled. Veins have valves to maintain unidirectional flow of blood. To maintain the unidirectional flow of blood, there are presence of valves. Okay, see here in the figure, these are the valves you are looking. Okay, they are the valves. Okay, points. The thickness of the wall is half the size of the corresponding artery. Three layers of from inside out. The same. The layers are same. They are called as tunica intima, tunica media, and tunica adventitia. Same. Tunica intima lined by squamous cell. Tunica media. Next point. You see here. Tunica media is thin. Okay, and some smooth muscle. Which layer is thick in vein? It is tunica adventitia. The tunica adventitia layer is very thick and it consists of vasa vasorum and one more longitudinal bundle of smooth muscle fiber. It consists of longitudinal bundles of smooth muscle fiber you see in the tunica adventitia. This is the identification point for large size artery. See here, in the histology figure you can make out same. What is that layer? Tunica intima is there, tunica media is there, and tunica adventitia. Okay, which layer is thick? You can make out the layer layer is thick is this one, that is the tunica adventitia. Okay, what do you see in the tunica adventitia? The bundle. These are the longitudinal bundles of the smooth muscle. You can look there. They are all longitudinal running smooth muscle fiber. You can see the longitudinal running smooth muscle fiber. So these are the features you see in the structure of a large size vein. So what are the example for large size vein? Vein of the body. You can see inferior vena cava is an example for large size vein. Next, superior vena cava is an example for large size vein. Larger vein you see, two vein, remember. Superior vena cava and inferior vena cava are example for large size vein. Okay, this is just to tell you arteries, arterioles, capillaries, venules and veins. Okay, how it forms. Okay, this is the histology structure of blood vessel. We have looked. See, on the right hand side you are seeing artery, large artery, muscular artery, arterial and that capillaries, and on the left you can see venules, capillary, venules, medium size vein and large size vein. It goes okay like that. So this is the you can see the difference between artery and the vein. So learn about it. So what? Okay, so these are the things to be you have seen here in the figure. Okay, so these are the things. Now okay, we'll revise about the two, what you have seen between the difference between the artery and vein. So remember, three layers are present: tunica intima, tunica media and tunica adventitia. In the artery, the thickest layer you can see here, that is the tunica media. In the vein, it is the tunica adventitia, the layer is thick. The layer is thick, and here it consists of bundles of the smooth muscle fiber. In the large size vein, tunica adventitia consists of longitudinal bundles of smooth muscle fiber. This is the histological difference between artery and vein, and learn the example for it. Okay, what are the example for artery and what are the example for the veins? So look, difference between arteries and the vein. Features, okay. Arteries and vein, thickness of the wall. In artery it is thick, here it is thin. Valves, absent, present. Lumen, narrower, larger. Internal elastic lamina, well defined, not seen. Tunica media, yes, we know that in the artery the layer which is thick is the middle layer, which tunica media layer is thicker, whereas in vein thinner. Okay, which is thick, then tunica adventitia layer in artery it is thin, whereas in vein the tunica adventitia layer is thickest. Okay, thickest coat, which is the thickest coat in the artery, it is tunica media, whereas in vein this is the tunica adventitia. So this is a difference between the arteries and the veins slide. Okay, next, what do you mean by capillaries? Microscopic blood vessel within the tissue, single layer of endothelial cell. Capillaries have arterial and venous. You know that arteries will carry the blood. Okay, this is a tissue. If you think they are small, from the capillary the artery will move into the venous end. So this is the arterial end and this is the venous end. So these are the region that is called as the capillaries. Okay, so see here, see this is the artery you're looking and this is the vein. You can see in the tissue, here this is the tissue you're coming. So there is the from the arterial vein, artery, arterial, then capillary. From the capillary it will go into venule and into the vein. So that is about the capillaries. Okay, next. In some region you don't see capillaries, okay. They are replaced by, they are called as sinusoid. Sinusoid replace capillary in certain organ like liver, spleen, bone marrow and endocrine gland. You see a sinusoid. Lumen is larger and irregular. Lumen is larger and so where do you see sinusoid? In liver, spleen, bone marrow and endocrine gland. You see the sinusoids. Okay, that is about what do you mean by capillary and sinusoid. Next, we'll look into next one, that is called as anastomosis. What do you mean by anastomosis? Anastomosis, you look, there are different types, okay. One is called arterial anastomosis, one is called venous anastomosis, one is called arteriovenous anastomosis. Okay, so why these anastomosis are present is there, if there is a region, any artery is damaged, if you think this region is damaged, there will be collateral circulation to that part, that is called as the anastomosis. Okay, so arterial anastomosis you see in your palm, this figure is of palm, that is called as a palmar arch. Okay, then venous anastomosis, you can see the bluish color in a hand, look that what you are looking is the dorsal venous arch. Okay, arteriovenous anastomosis, you can see in this, see arterial and venous, this is called arteriovenous anastomosis, you can look. So there are anastomosis are different. Arterial anastomosis completely, artery anastomose with another artery, that is called arterial. Venous vein anastomosis another. Okay, arteriovenous anastomosis are also present. So you can look in the figure here, arterial anastomosis, venous anastomosis, arteriovenous anastomosis. Okay, next. What do you mean by end arteries? Okay, see, you have looked, there are anastomosis. If I tell you this is one artery and this is one artery, if this will be forming an anastomosis, okay. Okay, in some region you don't see anastomosis between these two, they are called end artery. Arteries which do not anastomose with their adjacent arteries are called end artery. Where do you see end artery? Central artery of retina, central branches of cerebral artery. What will happen to this? See here. See, I told you end artery versus anastomosis. You can see in this figure. See, this is the artery and artery, anastomosis. If you ligature here, if this region is devoid of blood supply, the artery will flow through this, you can see flow, and go to this region and supply the nutrient to that region which is devoid of blood. Okay, but if you see in this figure, you see that the artery, there is no anastomosis. So if there is a damage to this artery, this region is devoid and there will be cause of the death of the cell or the organ of anything. So where do you see this type of end artery is one example, central artery of retina. Okay, if that artery is damaged, it will lead to a condition called as a blindness. So remember, end artery, no overlap in area of supply. Okay, so the artery, if that artery is damaged, it will lead to a condition called as the blindness. Central artery of retina. One more, you see branches of cerebral artery in brain, which will lead to a condition called as stroke. Arteries in kidney and liver also same. Okay, so remember what do you mean by end arteries. Okay, so summary of the today's class. To summarize about the today's class, we have looked into the blood vessel. So the blood vessel you learn about, we have looked at what do you mean by arteries, what do you mean by veins, what do you mean by capillaries, what do you mean by sinusoid, what do you mean by anastomosis, and what do you mean by end artery. Next, we have looked into the general plan of the blood vessel, which consists of three coats. From inside out, the three coats are tunica intima, tunica media, and the outermost one is called as the tunica adventitia. So there are three coats. So then we have looked in the artery, there are two. One is called a large size artery and one more is called a medium size artery. Large size artery, other name is elastic artery. Medium size artery, the other name is muscular artery. So remember, in the artery, the layer which is thick is tunica, medial layer is thick. So example, learn the example for large size artery and example for medium size. So difference between large and medium size is In large size artery, elastic fibers are more, whereas in medium size artery, smooth muscle fibers are more. Okay, so learn then what is the difference between the two. Seeing the slide, okay, just see, when draw a practice a diagram and look what is the difference and write the points to remember it. Okay. Then vein, we have looked into the large size vein. So example for large size vein is inferior vena cava and superior vena cava. Then which layer is thick? The tunica adventitial layer is thick, and remember the point there, it consists of longitudinal bundle of smooth muscle fiber. You see the longitudinal bundle smooth muscle fiber in large size artery. So all this point, okay, this is the summary of the class. Okay, thank you.